So good evening, everyone, and welcome to yet another one of our free CPD accredited webinars at Plant-Based Health Professionals UK. For those of you who are new to the programme, my name is Rahini Bajekal and I'm a nutritionist and communications lead for Plant-Based Health Professionals UK, and a community interest group that is dedicated to promoting the benefits of a sustainable and healthy plant-based diet. Tonight, I'm so excited to welcome registered dietitian, internationally renowned speaker and acclaimed author of 12 best-selling books in over 15 languages, Brenda Davis. And she's going to be talking about plant-based diets and the prevention, treatment and remission of type 2 diabetes. This is such an important topic and we've actually never covered it in detail on this webinar program in over a year. So the session might go slightly over time by about 15 minutes or so, but the recordings will be up on our website for members and hopefully you will be able to catch the Q&A, the live Q&A with Brenda at the end of this session. We're so grateful to be supported by our brilliant sponsors, the British Society of Lifestyle Medicine, who provide us with CPD accreditation for these webinars, ProVeg International and veganfitness.com, who kindly lend us their Zoom platform. Do join us in a couple of weeks' time, as we're also going to be covering another hot topic, plant-based diets and pregnancy. This is such an important topic, and we're going to have our very own Dr. Miriam Martinez-Biage from Plant-Based Health Professionals UK. She's the consultant pediatrician and an absolute expert on this subject. So we're going to really drill deep into the nutrients that are required for a healthy plant-based pregnancy, and do spread the word amongst people because it's suitable for health professionals as well as plant-based eaters who want to know how to optimize their plant-based pregnancy. Again, we really love if you would be open to joining us as a member. This is open to everyone, not just health professionals, and visit pbhp.uk to subscribe to our free weekly newsletters. You can also donate to support our advocacy work at pbhp.uk/donate and follow us on Facebook, Instagram and Twitter, where we're very active and we share all the latest evidence-based news on plant-based diets. So now I'd like to welcome Brenda Davis, who is an expert on this subject and we're all really excited to learn from for the next hour and a bit. And then at any point in the session, if you have a question for Brenda, please do note that in the Q&A box at the bottom of the screen and I will try and get to it in the Q&A. Thank you.
Thank you all for joining us this evening, and thank you for all the wonderful work that plant-based professionals are doing in the UK. I'm just amazed at what's being done, so thank you for that. This evening I'm going to be talking about plant-based diets and the prevention, treatment and remission of type 2 diabetes. This is my disclosures, and first a very brief overview. We're going to begin by talking about type 2 diabetes remission, the definitions, lines of evidence, diet and lifestyle therapies used to achieve remission. And the larger part of this evening will be talking about nutrition guidelines for the use of plant-based diets in the treatment and reversal of type 2 diabetes. So I want to begin by talking a little bit about remission. We have many definitions for remission, but no broad consensus. And I'll share a couple of definitions with you in a minute. In terms of terminology, there was some discussion about the terms remission versus reversal, but today remission is really considered the preferred term because it's used to describe a patient's status, and recurrence, of course, is possible. Reversal suggests cure, so it's generally avoided when referring to a patient's status. The term reversal, however, may be used to describe the process of recovery. So in terms of definition of remission, probably one of the first definitions that came out was from the American Diabetes Association Consensus Group in 2009, and they described partial remission as having hyperglycemia below the diagnostic thresholds for diabetes. In other words, people were in that pre-diabetic range for at least a year with no active pharmacologic therapy or ongoing procedures for their diabetes. A complete remission was defined as normal glycemic measures of fasting blood glucose of 5.6 millimoles per liter or less, and at least a year with no pharmacologic therapy or ongoing procedures. And then they defined prolonged remission as complete remission for at least 5 years. And then you're probably quite familiar with the Association of British Clinical Diabetologists and the Primary Care Diabetes Society's definition that very recently came out. And they had 3 criteria for remission: weight loss, blood glucose levels below the World Health Organization diagnostic thresholds, on 2 occasions separated by at least 6 months. And so a fasting blood glucose of less than 7 millimoles per liter, or an A1C of less than 48 millimoles per mole. Now, this is interesting, of course, because in the ADA definition, they've got the including both the rates for, the partial remission and the complete remission, whereas as in this definition, complete remission is anything that's not diabetes. The attainment of these glycemic parameters following the complete cessation of all glucose-lowering therapies is the 3rd criteria for remission. So a little bit of difference in definitions there. And the lines of evidence for remission actually initially came from bariatric surgery and then from diet and lifestyle programs, which we'll focus on this evening. And to give credit where credit is due, the twin cycles hypotheses by Roy Taylor really initiated a lot of the diet and lifestyle trials. And the twin cycles hypothesis is essentially that excessive fat accumulation in the liver and then in the pancreas causes insulin resistance and glucose intolerance. And so, of course, if you reverse that accumulation, that fat accumulation in these areas, you can actually reverse the disease. And so the diet and lifestyle therapies that have been used to achieve remission include low calorie and very low calorie diets, low carbohydrate and very low carbohydrate diets, and of course, plant-based diets. Where low and very low carbohydrates are concerned, we see a number of studies, beginning with the look ahead that took place between 2003 and 2015. This was a very sort of moderate low calorie diet, about 12 to 1800 calories per day. And the remission rates were not that impressive, about 11.5% at 1 year and 7.3% at 4 years. Now, the Counterpoint trial, and this is Roy Taylor's team, very small pilot study, but the results were just astonishing. So this was basically liquid meals plus non-starchy vegetables, and remission was achieved within 7 days of starting this program. Not only that, but beta cell function and insulin sensitivity were absolutely normalized. So very, very impressive. And Roy Taylor's twin cycles hypothesis was essentially confirmed by this study and the studies that followed. In 2016, the Counterbalance study, again, a very low calorie diet for 8 weeks, weight maintenance for 6 months. And at 6 months, 12 of the 30 participants had fasting blood glucose levels below the diabetes or the threshold for type 2 diabetes. And then in 2008, the very important DIRECT trial, which showed very low calorie diets for 3 to 5 months, followed by a long-term weight maintenance program, resulted in some pretty impressive remission rates. And the remission rates were reported in 46% of the participants in the intervention group and 4% of the participants in the control group. But what was really interesting is how profoundly remission rates were directly correlated with weight loss. And so remission was 86% in people who lost 15 kilograms or more, and 57% for those who lost 10 to 15 kilos, 34% for 5 to 10, and only 7% for 0 to 11 kilograms. So sufficient weight loss provides a very, very strong ability to go into remission for people. We have some other international trials that are worth looking at as well. A trial from Thailand in 2019, just 20 individuals, but again, a very low calorie diet. This one used solid foods for 8 weeks, followed by a 4-week transition, and remission rates were 79% at 12 weeks and 30% at 12 months. And then another study from India, which was much more moderate in terms of the caloric restriction. They allowed 1,500 calories a day, but also included 1 hour a day of walking. And their complete or partial remission was 75% at a year and 69% at 2 years, and complete remission was 50% at 1 year and 47% at 2 years. So very, very interesting studies. In terms of low carbohydrate and very low carbohydrate diets, we do have evidence for weight loss, improved glycemic control, and medication reduction. But these diets have not been shown to improve insulin resistance or beta cell dysfunction. And they have a lot of potential adverse effects: increased risk of cardiovascular disease, gout, and kidney stones, and potential negative impact on renal function. We have a metabolic ward trial that I think is just very interesting from 2020, and it compared people eating low-fat plant-based diets, 75% carbohydrate, 10% fat, with keto diets, which were the exact opposite, 10% carbohydrate and 75% fat. And it was a 2-week crossover design with unrestricted food intake. And what that means is every individual that was part of the study did both the diets and then did the low-fat plant-based and then crossed over to keto or vice versa. On the ketogenic diet, people had reduced blood glucose, insulin, and triglyceride levels, but they had impaired glucose tolerance, and they had increased loss of fat-free mass or muscle tissue. In the plant-based diet, there was lower blood pressure, lower cholesterol, and lower energy intakes, in spite of the fact that it was unrestricted food intake. And it was presumed this was because the foods were much higher in fiber and more satiating. And they had increased fat loss, significantly higher fat loss than on the ketogenic diet, 51 grams a day versus 16 on the ketogenic diet. And there's another study with over 40,000 individuals that showed low carbohydrate diets high in animal protein and animal fat being associated with a 37% increased risk of type 2 diabetes, whereas low carbohydrate diets that were high in plant protein and fat were not associated with an increased risk overall, but were associated with a 22% decreased risk in men under 65 years of age. In terms of plant-based diets, we have evidence for weight loss, improved glycemic control, medication reduction, improved insulin sensitivity, and improved beta cell function. The real bonus is that it doesn't come with the potential adverse side effects that the low carbohydrate diet comes with. In fact, it reduces risk of other chronic diseases like cardiovascular disease, which is hugely important for people with type 2 diabetes. And evidence for remission at this point in time is fairly limited, but the American College of Lifestyle Medicine right now is actively gathering data and working on a report on remission with plant-based diets. And if we look at the early work with plant-based diets, I think what among the most interesting is James Anderson's work. This took place between 1978 and 1991, and they reported that high fiber, high carbohydrate plant-based diets resulted in significant reductions in body weight, blood glucose, and need for insulin or diabetes medications. And I believe that they actually achieved remission in a number of individuals, but remission was not on the table in those days. It was believed that there was no such thing, that people couldn't go into remission once they had type 2 diabetes. What was really interesting about his work is he used a very high fiber diet. It was 35 to 40 grams per 1,000 calories, and it was 70% of calories from carbohydrate. And then Nathan Pritikin's team as well in the early 80s, I believe, also achieved remission with some of their participants. We have a small trial, Dunaif and Furman from the United States in 2012. It was a pilot study with 13 adults, and they used a whole food, high nutrient density plant-based diet for 7 months. Mean A1C dropped from 8.2% to 5.8%. 62% of patients achieved normal glycemic measures, which is an A1C of under 6%. Mean weight loss exceeded that sort of limit that Roy Taylor set of 15 kilograms. And they averaged 21.4 kilogram loss of body weight. We have a study from New Zealand as well, 2017, with 33 intervention group participants, 32 control participants who had a BMI of over 30. Not all of them had type 2 diabetes. Some had type 2 diabetes, some had ischemic heart disease, others had hypertension or hypercholesterolemia. They followed a non-energy restricted whole food plant-based diet with added B12. And the mean BMI reductions were 4.4 points for the intervention group and 0.4 for the control group. And the medication changes were a reduction of 29% in the intervention group and 8% in the control. And of the 7 people in the intervention group with type 2 diabetes, 2 no longer met the diagnostic criteria. So this is a very small study, but still reasonably favorable results. You may be very familiar with the work of PCRM and the PCRM team. They compared a low-fat vegan diet with an American Diabetes Association diet, and they did a number of trials, and both the low-fat vegan diet and the ADA diabetes diet improved glycemic and lipid control, but these improvements were significantly greater with a low-fat vegan diet than with the ADA diet. And a similar study in the Czech Republic, but in this study, they did include up to 1 serving of low-fat yogurt a day. So it was essentially a vegetarian diet, but pretty near vegan versus a conventional diabetic diet. And the calories were restricted, 500 fewer calories a day than the normal diet. And what we see is the experimental group had about twice the weight loss. The insulin sensitivity was 30% greater in the experimental group and only 20% greater in the control. But the biggest difference was the reduction in type 2 diabetes medications, reduced by 43% in the experimental group and 5% in the control. Another study from South Korea, 2016, with 93 participants, again comparing a vegan diet with a conventional Korean Diabetes Association diet. And again, in terms of mean A1C reductions, the vegan diet was about twice as effective, or more than twice as effective as the KDA diet. And glycemic control was also better with the vegan diet. And we have now, between 2016 and 2019, 6 reviews and meta-analyses on plant-based diets and in the treatment of type 2 diabetes. And they reported that these diets aid in weight loss, improve insulin sensitivity, decrease blood glucose levels, improve blood lipids, reduce or eliminate the need for medication, and decrease the risk of complications. And I myself had the privilege of working with the people of the Marshall Islands, and they have among the highest rates of diabetes in the world, ranging usually from about 30 to 37% of the adults with type 2 diabetes. And if you're not familiar with where the Marshall Islands are, they're somewhere between Hawaii and Australia, very remote, just north of the equator. And we went in and did a diabetes intervention research project, a randomized clinical trial. And we had 5 overlapping cohorts that we worked with. And we used a high fiber plant-based diet to treat their diabetes. It was a comprehensive program with physical fitness and stress management and all of those things as well. And in the first 2 weeks of the trial, we saw a drop in fasting blood glucose of almost 4 millimoles per liter. And at 12 weeks, it was about 2.7 millimoles per liter. A1C at 12 weeks was down almost 2 points. And CRP was down about 1.2 points at 2 and 12 weeks. So a lot of people say, well, why is it that plant-based diets are so effective for people with type 2 diabetes? And they are effective for the very simple reason that they address the root causes of the disease. They essentially put a lid on the drivers of insulin resistance: inflammation, lipotoxicity, glycotoxicity, dysbiosis, oxidative stress, all of those things. And of course, the most effective dietary patterns minimize pathogenic dietary components and maximize protective dietary components. The protective factors in foods, as we know, are fiber, phytochemicals, the enzymes that are responsible for converting phytochemicals, some phytochemicals, to their active forms, antioxidants, anti-inflammatory compounds, plant sterols and stanols, pre and probiotics, and of course, macro and micronutrients that come from foods that provide us with all of the above. And when you look at the list, the thing that jumps off at the page at you is that these components are found either predominantly or exclusively in whole plant foods. Whereas if we look at pathogenic factors like trans fats, excessive saturated fat, refined carbohydrates, excessive sodium, Nu-5-GC, which is a pro-inflammatory molecule in meat, chemical contaminants, products of high temperature cooking, pro-oxidants, TMAO, and endotoxins, these are components that are concentrated in one of two places: highly processed foods and animal products. And because Western diets, and unfortunately in increasing numbers, diets of people in developing countries, are low in protective factors and high in pathogenic factors, they escalate the risk of type 2 diabetes and its complications. I want to move on to talk about our treatment goals and specifically how to construct a diet that really works. Our primary clinical treatment goal for type 2 diabetes is the sustained remission of type 2 diabetes. When remission is not possible, and it is not possible for some individuals, especially individuals who have had diabetes for several decades, the primary goal then becomes to minimize medications and optimize health outcomes. To achieve optimal health outcomes, we need to produce adequate weight loss, we need to restore insulin sensitivity, and we need to restore nutritional health. So let's consider 10 nutrition guidelines for the prevention, treatment, and remission of type 2 diabetes. Number 1 is to achieve and maintain a healthy body weight. Reduction in body fat stores is really key. It's key to reducing sufficiently fat stores in the liver and the pancreas to allow for a return of insulin sensitivity. So the restoration of healthy body weight is directly associated with diabetes remission, as we saw in the DIRECT trial. Even a modest loss of 5 to 10% of initial body weight can improve insulin sensitivity and glycemic control, but it's not usually sufficient for remission. So what diet is really best for weight loss? Well, any diet that provides a caloric deficit can produce weight loss. But the diet that is truly best for weight loss is one that also supplies adequate nutrients, protects against chronic diseases like cardiovascular disease and cancer, is accessible, sustainable, and culturally appropriate. And these are all hugely important, because if it's not accessible, people can't do it. If it's not sustainable, then the diabetes remission will not be sustained. And if it's not culturally appropriate, again, people won't stick to it long term. The diet has to promote a negative caloric balance. It's got to reduce total calories and increase energy increase energy expenditure. But cutting calories is actually more effective than increasing exercise, although ideally we want to do both. Calories from food add up very quickly. Calories burned from exercise add up very slowly. So that's why we really need to focus on the food. Effective approaches to energy restrictive are many. To energy restriction, I should say, are many. Fasting or modified fasting, although not appropriate for everyone, can be appropriate and very, very effective for a lot of people. So we're talking about time-restricted feeding. So maybe people are eating from 8 in the morning until 6 o'clock at night. Intermittent fasting, so you're reducing energy 2 to 3 days a week or on alternate days. And then, of course, there's continuous energy restriction, as you might achieve with a whole food plant-based diet or lower, very low-calorie diets. And there is some evidence to suggest that eating fewer meals is more effective than eating the same number of calories in a lot of meals. For example, 2 meals versus 6 meals a day. And also, there is evidence that demonstrates that modifying timing of meals may be helpful as well. So, for example, not eating a couple of hours or even 3 or 4 hours before bedtime can help reduce risk. Practical pointers here. We want to practice portion control. Even the healthiest energy-dense foods can make it difficult to lose weight if you're over-consuming them. And we found this in the Marshall Islands. At first, we did what a lot of people doing plant-based diets do and provide unlimited food and unlimited calories. And what we found is that people ended up eating a lot of concentrated carbohydrate sources. So if we put out the bowls of brown rice, they might eat 2 or 3 cups. And we found that in this situation, it did not work. We didn't achieve the weight loss we were going for. So we started to measure out portions of more concentrated carbohydrate sources and also of the concentrated fat sources. Nuts and seeds contain 600 or 800 calories per cup. So overeating them can add up to too many calories pretty quickly. We want to encourage the consumption of less calorically dense foods. So calorically dense foods, when you eat a lot of calorically dense foods, it means you can only eat a small portion of food. And if you're aiming for 1,200 calories a day, you're done quickly. Whereas if you're eating less calorically dense foods, you can eat a much greater volume of food. And so that's much more satisfying for people. And the good news is that whole plant-based foods have low caloric density, even things like beans and barley, compared to things like oil and potato chips, for example. And we need people to be drinking water, not sugar. This is just, it's a no-brainer, but it's extremely important. And I would say avoid snacking if at all possible. Aim for at least 4 to 6 hours between meals. Drink water or herbal tea between meals. And if snacks are consumed, we should be sticking to raw vegetables or fresh fruit. Number 2 is to make whole plant foods your sources of carbohydrates. Carbohydrates, contrary to popular opinion, are not the enemy. Carbohydrates from whole foods are consistently protective to human health. In fact, percent of calories from carbohydrates has very little influence on diabetes risk. The lowest rates of diabetes in the world are found in populations eating high carbohydrate diets. The quality of carbohydrates, especially if you're not overeating calories, is what determines health outcomes. Quality is determined by the source of the carbohydrates, the degree to which those carbohydrates are processed, and the glycemic response to the food. Poor quality carbohydrates are refined carbohydrates. They increase the risk of diabetes and its complications. So what are refined carbohydrates? Well, they're high carbohydrate foods that have been stripped of almost everything of value to human health by food processing techniques before we eat them. They include refined sugars and, of course, refined starches like white flour products. And unfortunately, most of the carbohydrates people eat are refined. When we look at the data on this, sugar-sweetened beverages increase diabetes risk. There was a meta-analysis of 10 studies done in 2017, and the highest versus the lowest intake of sugar-sweetened beverages was associated with a 30% increased risk of type 2 diabetes. And every serving, every 250 mils or 8 ounces of sugar-sweetened beverages actually increased risk by 21%. So what's a safe level of added sugar? Well, the British Nutrition Foundation suggests no more than 5% of calories from added sugar, and that's about 6 teaspoons or 30 grams in a 2,000 calorie diet per day. And if we look at what people are actually eating, they're eating, most adults are eating 70 to 20 teaspoons a day, and adolescents actually consume even more than that. A teaspoon of sugar is about 4 grams of sugar if you're looking at food labels. And when you think 6 teaspoons of sugar a day is what's recommended as an upper limit, you look at a single serving, a 12-ounce can of soda, a flavored coffee, a cup of fruit yogurt, a pastry or a cinnamon bun, often are 10 to 12 teaspoons of sugar, so almost double the upper recommended level. Even foods we don't think of as being terribly sweet, like energy bars and barbecue sauce and things like that, can be very close to our upper limit in one serving. And in terms of refined starches and type 2 diabetes risk, there was a study comparing highest versus lowest quintiles of intake of refined starches, and they found they were associated with a 23% increased risk of type 2 diabetes. When we refine grains, we lose a lot. We lose about 80 to 90% of the fiber, 70 to 80% of the vitamins and minerals, and 95% of the protective phytochemicals. And of course, nobody eats a bowl of white flour. Before you eat the bowl of white flour, we tend to add things like fat and sugar and salt and often food additives. And then we eat the white flour, and therein lies the problem. Not only have we removed most of what is of value to health when we refine the product, but we add so many components that we know are detrimental to health before we eat them. High quality carbohydrates, on the other hand, are unprocessed or minimally processed carbohydrates containing fiber, antioxidants, phytochemicals, and a host of macronutrients. And these foods are all of the whole plant foods listed here. High quality carbohydrates have proven protective in a study of over 70,000 women followed for 24 years, comparing extreme quintiles of consumption. Unrefined, fiber-rich carbohydrate was associated with a 20% decreased risk of type 2 diabetes. And if we look at whole grains and type 2 diabetes, a 2016 meta-analysis of 45 studies reported a reduced risk of mortality per 90 grams or 3 ounces of whole grains, a 17% reduction in all-cause mortality, 22% in cardiovascular mortality, and 51% in diabetes mortality. This is what the carbohydrate naysayers tend to forget. They forget that the healthiest foods on the planet, those loaded with fiber and phytochemicals and antioxidants, fruits and vegetables and grains and legumes, and all of these foods are predominantly carbohydrate in terms of their calories. They are about 60 to 90% of calories from carbohydrate. The only exception in the plant kingdom is nuts and seeds, which are 12% of calories from carbohydrate. These are our main sources of healthy fats. Practical pointers here: we want to get carbohydrates from high fiber whole plant foods, avoid added sugars, especially in beverages, and minimize all refined carbohydrates, both starches and sugars. Number 3 is to bulk up on fiber. Fiber intake reduces type 2 diabetes risk. There was a study that showed that people who met the AI in North America for fiber, which is over 14 grams per 1,000 calories, it reduced diabetes risk by 20 to 30%. There was another meta-analysis of 17 studies that reported a 6% decrease in diabetes risk for every 2 grams of fiber intake. So imagine if you're eating 60 grams, it's pretty impressive. So how does fiber afford protection? Well, it, number 1, promotes a healthy gut microflora, and this is really important. Our gut microflora affects everything, which I'll talk a little bit more about later. It facilitates weight loss, helps regulate appetite, control blood glucose, improve insulin sensitivity. It helps to reduce inflammation, and of course reduces our risk of cardiovascular disease, colorectal cancer, and overall mortality. Intakes recommended by the British Nutrition Foundation are 30 grams a day for adults. Actual intakes are about 2/3 of that. High fiber intakes more than 20 grams per 1,000 calories per day from a combination of sources with at least a third viscous or soluble fiber improves glycemic control and blood lipids. And of course, you recall James Anderson used 35 to 40 grams of fiber per 1,000 calories and achieved excellent results with that. And it's really interesting to look at the research on insoluble versus soluble fiber. We normally think soluble fiber is the only thing that is beneficial in terms of type 2 diabetes risk. Soluble fiber actually improves glycemic control a lot, but insoluble fiber actually reduces diabetes risk. So I would say both types of fiber are important, but we do need to focus for people who do have diabetes on ensuring sufficient soluble or viscous fiber in the diet. And the most concentrated source of fiber, as most people know, is legumes with 10 to 20 grams per cup. And other high fiber foods are avocados, grains, berries, and then of course we get some fiber from vegetables, fruits, nuts, and seeds. Of course, only plant foods contain fiber. Low fiber foods include refined carbohydrates, fast foods, highly processed foods, and no fiber foods include meat, poultry, fish, eggs, dairy products, fats, oils, and sugar. Practical pointers here. We want to include a wide variety of high fiber foods in the diet. We want to include foods rich in soluble fiber and select unprocessed legumes or grains at every meal if possible. Number 4 is to enhance gut flora. What we know is dysbiosis is associated with the development and progression of type 2 diabetes. An unhealthy gut microbiota contributes to increased gut permeability, low-level inflammation, the accumulation of visceral fat, insulin resistance, and metabolic endotoxemia. Diet determines the health of the gut microbiome. Western diets and paleo diets and other low carbohydrate diets are associated with changes in the gut microbiota that fuel obesity and metabolic disease. Higher fiber, whole food, plant-based diets feed friendly microbes and support a healthy gut flora. Practical pointers here. We want to eat more prebiotics, fiber from whole plant foods, resistant starches. We want to eat food-based probiotics such as cultured and fermented foods. We want to minimize intake of foods associated with dysbiosis, highly processed foods, fried foods, and meat. Avoid artificial sweeteners. Several of the artificial sweeteners have been associated with dysbiosis, and avoid excessive alcohol consumption. Number 5 is to aim for a low glycemic load. Basically, we have convincing evidence from meta-analyses that a low GI/GL diet reduces the risk of type 2 diabetes, improves glycemic control in people with both type 1 and type 2 diabetes, improves insulin sensitivity and beta cell function in people with diabetes, improves blood lipids and inflammatory markers, including C-reactive protein, and reduces the risk of cardiovascular disease. And the impact has actually been quantified in a meta-analysis of 24 studies. The risk of type 2 diabetes rose by 27% for every 10 units of GI added to the daily diet, and 26% for every 80 grams of glycemic load in a 2,000 calorie diet. And the authors concluded our evidence indicates that GI and GL are substantial food markers predicting the development of type 2 diabetes worldwide. So practical pointers here, we want to make wise GI/GL choices. Emphasize non-starchy vegetables, legumes, nuts, and seeds. Control serving sizes of starchy vegetables and grains. Select lower GI vegetables and whole grains, like squash instead of potatoes, intact rather than ground grains. We want to include foods shown to reduce the glycemic impact of meals, like legumes, healthy fats, and acids like lemon or lime juice and vinegars, and potentially some herbs and spices like cinnamon. And we want people to be aware of the differences within food groups of the glycemic impact of food. So for example, in the grain group, barley has the lowest GI of any grain. Rice tends to have a higher GI, especially lower amylose rices like jasmine or sticky rice. And so we definitely want to educate people about choices within each food group. And there are some cautions about using the GI and GL, and it's important to recognize they don't just determine the nutritional quality of food. For example, low carbohydrate foods have a very low GI and GL, even though they can increase risk of type 2 diabetes and the complications of diabetes, like processed meats, for example. High fat foods like deep fried potatoes actually have a lower GI than a more healthful baked potato. It doesn't make it a better choice. Number 6 is to pick plant protein sources. There was a study looking at meat and fish intake and type 2 diabetes risk that was just released in 2020. And it was a meta-analysis of 28 articles. And the risk of type 2 diabetes increased by 31% for every 100-gram serving of red meat, and by 46% for every 50-gram serving of processed meat. There was no significant association in this study for poultry or fish. There was a study from Canada looking at high protein intake and type 2 diabetes. Over 6,000 individuals, they found people eating more than 20% of calories from protein. And to put this in context, paleo diets average about 30% of calories from protein, mostly from meat. If you look at people 50 to 65 years of age, they had increased almost 4 times the risk of type 2 diabetes compared to people consuming less than 20% protein. And for people over 65, the risk was increased over 10 times. However, the associations between protein intake and diabetes risk were either abolished or greatly attenuated when the protein came from plants. And if we look at legumes and type 2 diabetes risk, we have a study of almost 65,000 women showing, in terms of highest versus lowest quintile of intake, a 30% risk reduction with the higher intake of legumes, and a 47% risk reduction with soybeans in the highest versus lowest quintile. And it makes sense. If you think about the food components that are most protective, the fiber and phytochemicals and antioxidants and probiotics and sterols and stanols, they're either high or very high in legumes and basically absent in meat. And if you look at the things we're trying to reduce in the diet, the trans fat, saturated fat, heme iron, new 5-GC, all of those things are either absent or very low in legumes and either moderate or high in meat. Practical pointers here, we need to be getting our protein from plants. And I would say to eat whole legumes at least once a day. Include some minimally processed soy foods as well, like tofu, tempeh, and unsweetened soy milk. Eat moderate amounts of nuts and seeds. And select the highly processed veggie meat alternatives less often. Number 7, get fat from whole plant foods and include omega-3 fatty acid sources in the diet. One of the big questions in terms of plant-based diets is how low should we go? We've seen success with very low fat diets like the diet used by PCRM, success with moderate fat diets in the range of 16 to 25% of calories from fat, and we've seen success with higher fat plant-based diets like Mediterranean diets, providing 30 to 40% of calories from fat. There are, however, advantages to low or moderate fat diet because fat is 2.5 times more concentrated in calories than carbohydrates or protein. So a tablespoon of oil provides 120 calories. 14 cups of dark greens provides 120 calories. Eating less fat means eating more food for the same number of calories. So whole plant foods tend to have a low caloric density. And so it makes sense to go with a slightly lower or more moderate fat diet. And fat quality appears to be more critical than percent of energy from fat, where both risk and progression of diabetes is concerned. This is no different than it is for carbohydrates or protein. When we look at types of fatty acids and type 2 diabetes risk, trans fats and saturated fat from meat, but apparently not from dairy, have adverse effects on fasting plasma glucose and insulin sensitivity, whereas unsaturated fats tend to improve insulin sensitivity. Oxidized fats are worth considering as well, because exposing fatty acids to high temperature heat, and that is in the form of grilling or frying, promotes the formation of oxidized fats. And this increases the risk of non-alcoholic fatty liver disease, insulin resistance, and type 2 diabetes. The most healthful fats come from high-fat whole plant foods that are rich in unsaturated fats and a myriad of protective dietary components like fiber and phytochemicals and antioxidants and sterols and stanols and so forth. There are studies looking at nuts and type 2 diabetes risk as well, and when fully adjusted, type 2 diabetes risk was half in those consuming 4 or more servings of nuts of nuts per week compared to those consuming less than 1 serving of nuts per week. We also need to optimize omega-3 fatty acids, ensuring sufficient alpha-linolenic acid, and I would suggest 2 to 4 grams a day, and also considering direct sources of EPA and DHA. And if you look at what plant sources offer alpha-linolenic acid, it's predominantly walnuts and seeds like chia seeds, flax seeds, and hemp seeds are all relatively concentrated sources. Leafy greens, about half the fat in leafy greens is omega-3 fatty acids, more in some greens than that, but they're so low in fat you would have to eat like a horse or a cow to get enough from greens alone. We also want to consider direct sources of EPA and DHA. Type 2 diabetes may actually negatively affect desaturase enzymes responsible for converting ALA to EPA and DHA. And EPA and DHA has been associated with hypolipemic and anti-inflammatory effects, and even small reductions in A1C in some studies. Fish, of course, is the primary dietary source of EPA and DHA, but is also a notable source of contaminants that can negatively impact diabetes outcomes. So I would recommend microalgae-based EPA and DHA. It's essentially a safer plant-based option. Practical pointers here: be really picky about your sources of fat. Get most of your fat from whole plant foods. Minimize saturated fat, especially from meat. Avoid highly processed foods with added fat. Avoid fried foods. Minimize concentrated fats and oils in cooking. And include reliable sources of omega-3 fatty acids in the diet. Number 8 is to maximize phytochemicals and antioxidants. The most antioxidant and phytochemical rich foods are vegetables, fruits and berries, legumes, grains, nuts, seeds, herbs and spices, sprouts, fermented foods, and green tea. And phytochemicals and antioxidants protect against diabetes and enhance dietary treatment. The mechanisms of action are many. They reduce oxidative stress and inflammation, they enhance gut microbiota, improve fasting glucose and insulin sensitivity, stimulate insulin secretion, activate insulin receptors, and promote insulin signaling. And if we look at studies on some of the most antioxidant and phytochemical rich foods, vegetables and fruits, we have a meta-analysis of 10 studies that found for each serving, risk of type 2 diabetes was reduced by 13% for green leafy vegetables, 10% for other vegetables, and 7% for fruit. So this is really pretty impressive. Practical pointers here: we want to think variety. The wider the range of vegetables, fruits, legumes, whole grains, nuts, and seeds in the diet, the greater the variety and content of phytochemicals and antioxidants will be. We want to think color. The richest sources of phytochemicals and antioxidants are often the most colorful. We can pick purple instead of white onions, dark instead of light greens, black instead of brown rice, red or black legumes instead of white legumes, for example. We can eat more raw foods. So raw foods contain enzymes that can help convert phytochemicals into their active forms. For example, in cruciferous vegetables, we have an enzyme called myrosinase that helps to convert glucosinolates into isothiocyanates like sulforaphane. And in allium vegetables, we have an enzyme called alanase that helps convert allan to allicin. We can also start sprouting or buying sprouts, the phytochemical army in a plant that is poised to protect a new little baby delicate plant often multiplies by 5 to 50 times in sprouts. We want to pile on herbs and spices because gram for gram, these foods contain more antioxidants than almost any other food on the planet. We also want to consider drinking antioxidant-rich teas, which can add a further boost to our antioxidant status. Number 9 is to minimize dietary contaminants. The worst offenders are environmental contaminants and the byproducts of high temperature cooking. When we talk about environmental contaminants, we're talking about pesticides in conventional produce, heavy metals like mercury in fish and seafood, arsenic in rice, chicken, fish, and seaweed, and persistent organic pollutants in fish, meat, and dairy products. Of course, they move up the food chain. They do a lot of damage. These compounds can increase oxidative stress, fuel inflammation, disrupt hormones, damage vital organs, including beta cells, damage DNA and the central nervous system. The solutions here are to choose organic when it's possible and accessible for us, to eat lower on the food chain, which means eating a plant-based diet, and to vary our grains. Inorganic arsenic can increase the risk of type 2 diabetes and cardiovascular disease. So by eating a wider variety of grains, we're putting a bit of a lid on arsenic consumption. And the other thing we can do is to carefully select rice. The amount of arsenic in rice varies with the location it's grown. We can also cook grains in a large amount of water and drain them before eating them. So for example, 6 to 10 times more water than grain. And they actually turn out just fine by cooking them this way. The products of high temperature cooking like heterocyclic amines, polycyclic aromatic hydrocarbons, and advanced glycation end product can have a huge impact as well. We know that meat cooking increases diabetes risk. There was a study of over 138 individuals that found open flame or high temperature cooking more than 15 times a month, so that's every second day, for example, versus less than 4 times a month, was associated with a 27% increased diabetes risk. Heterocyclic amines are known carcinogen. They're also associated with increased risk of type 2 diabetes. They're formed in meat, poultry, and fish when cooked at high temperatures. So they don't form in plant foods at all. Polycyclic aromatic hydrocarbons are known mutagens. They're linked to lung, skin, and genitourinary cancers. They have a positive association with type 2 diabetes, and they're present in any charred food, animal or plant-based. Anything that's blackened will have polycyclic aromatic hydrocarbons. Advanced glycation end products are associated with prediabetes, diabetes, and the complications of diabetes. They contribute to insulin resistance. And the most concentrated sources are grilled and fried processed meats like bacon and wieners. But they're also present in meat, poultry, or fish that's grilled, or other grilled or broiled foods, dark roasted nuts and seeds as well. Solutions here: avoid charred or blackened foods, especially meat, poultry, or fish. Avoid fried foods. Use moist cooking methods more often. Moist cooking methods are steaming, stewing, boiling, water sauteing. These produce fewer products of oxidation. And number 10 is to ensure micronutrient needs are met. And people with diabetes often have micronutrient deficiencies. So we want to be choosing really nutrient-dense foods to help ensure adequate nutrients, especially in the face of caloric restriction. The micronutrients of greatest concern for people with diabetes are B12, vitamin D, potassium, magnesium, chromium, and the antioxidant nutrients provitamin A, carotenoids, vitamin C, and vitamin E. People eating varied whole food plant-based diets generally get plenty of all of those nutrients with 2 exceptions, and the exceptions are vitamin B12 and vitamin D. Vitamin B12, we know metformin reduces vitamin B12 absorption, and we also know whole plant foods are not reliable B12 sources. So Low B12 can negatively impact fasting glucose and inflammatory markers in people with type 2 diabetes. So for those individuals 65 plus or who are on metformin, a daily supplement of 1,000 micrograms of B12 is recommended. Vitamin D, low vitamin D status has been associated with reduced insulin release, insulin resistance, and systemic inflammation. And most people do not get sufficient vitamin D from sunshine. Plant-based diets offer fewer food sources of vitamin D, so supplementation is generally very well advised. So in summary, I want to look at what to eat. And the first thing to eat is non-starchy vegetables and fruits, and we're aiming for 9 or more servings a day. We want to go for variety and color. We want to make dark greens a dietary staple, optimally aiming for 3 servings a day. We want to include berries because berries have the highest antioxidant levels and the lowest sugar levels of all fruits. We want to select unprocessed or minimally processed choices. So unprocessed would be fresh fruits and vegetables. Minimally processed might be frozen plain fruits and vegetables. And then we want to limit moderately processed limit or avoid moderately processed choices like canned fruits and vegetables, and completely avoid highly processed choices like sweetened fruit-based desserts, deep fried vegetables. Legumes, we want 2 or more servings per day, and a serving is a half a cup or 125 mils. And essentially, we want to aim for at least 1 serving of whole legumes, beans or lentils every day. We want to feature legumes at most meals, even breakfast. I consistently add lentils to my intact grains that I'm cooking for breakfast. So, and scrambled tofu, there's all sorts of ways. Using soy milk can be ways of adding legumes at breakfast. We want to select unprocessed or minimally processed choices like beans, lentils, peas, tofu, tempeh, bean pastas can be an option as well. We want to minimize moderately processed choices and completely avoid highly processed choices. Whole grains and starchy vegetables, generally 2 or more servings a day is appropriate. We want to keep our grains mostly intact. All grains are not created, I should say all whole grains are not created equal. A granola bar doesn't equal a bowl of oatmeal, and a box of kamut flakes does not equal a kamut berry salad. There is a hierarchy of whole grains. Even after you've eliminated refined grains, even within that whole grain hierarchy, there are degrees of processing and differences in glycemic impact of those grains. At the top of the whole grain hierarchy are intact whole grains, like barley and oat groats and quinoa. These are grains that have had nothing harmful added and nothing healthful removed. They have a low glycemic index. They take the body a while to break down and to be digested. Next would be cut whole grains like steel cut oats, then rolled whole grains like rolled oats, then shredded whole grains like shredded wheat, then ground whole grains like whole wheat flour products, then flaked whole grains like cereals, and then puffed whole grains like puffed wheat, puffed rice, and puffed millet. And as you go down this hierarchy, you are increasing the surface area of the food. You are increasing its glycemic impact. You are also reducing the nutritional value by exposing the food to greater levels of processing. So when you're treating someone to try to reverse diabetes, you want to stick to the very top of the whole grain hierarchy and make sure the vast majority of grains are being consumed intact, as opposed to in the form of breads and crackers and pretzels. We want to select colorful starchy vegetables prepared without added fat. And we want to adjust our intakes of grains and starchy vegetables depending on our energy needs. So once our recommended intakes for all the other food groups are met, you add grains and starchy vegetables to achieve energy intake goals. And for people that are on severely energy restricted diets, they won't have a lot of room for these foods. So we need to be cautious of that. We want to select unprocessed or minimally processed choices most of the time. We want to minimize moderately processed choices like flaked or puffed whole grains. We want to completely avoid highly processed like refined grains and whole grain snack foods with added fat, sugar, and salt, or fried starchy vegetables. And nuts and seeds, we want 1 or more servings a day. And we want to go for variety and omega-3s. When you look at the nutrition profile of different nuts and seeds, it is amazing how they each offer something distinct and valuable to health. Some are great sources of omega-3s, some of vitamin E, some of calcium or iron or zinc, or potassium or selenium. And so by including a variety of these foods, we get the best of all worlds. We want to keep our portion sizes moderate because of the caloric density in nuts and seeds, and especially for people who are trying to lose weight. We want to include 1 or more choices that are rich in omega-3s. And of course, we want to select unprocessed or minimally processed choices, nuts and seeds in their shell, raw shelled seeds and nuts, soaked or sprouted nuts or seeds, or the minimally processed like dry roasted nuts or seeds, natural nut or seed butters. We want to minimize the moderately processed choices with added oils, for example, and completely avoid highly processed choices like those that might have sweet coatings. We want to use herbs and spices generously, incorporate them at every meal that we can, expand our variety, learn from various ethnic cultures that use a lot of different herbs and spices, and benefit from that ourselves. There are a number of studies showing that some herbs and spices can help fight type 2 diabetes. In particular, we've got reasonable evidence for turmeric, cinnamon, and others like cardamom and cumin, and fenugreek and ginseng and ginger. But we do want to be stingy with salt. High sodium intake is strongly associated with cardiovascular disease risk in individuals with type 2 diabetes. And most of our sodium is concentrated in highly processed foods, 75 to 80%. So we want to eat mostly whole foods and avoid highly processed foods for yet one more reason. And our take-home message is every time you eat or drink, you either feed diabetes or you fight diabetes. Whole plant foods are powerful medicine for people with type 2 diabetes. And I know that not everyone is willing to make kind of dramatic, necessary lifestyle changes that would actually put a person into remission. But everyone has a right to know that lifestyle changes are a safe and highly effective treatment option. And I believe that it is time that healthcare systems offered lifestyle treatment programs as the first line of therapy for lifestyle-induced diseases like type 2 diabetes, and offered food services that promote health and healing. And these are the most recent books I've written on diabetes, Kick Diabetes Essentials, and the Kick Diabetes Cookbook. And with that, I will take any questions you might have.
Thank you so much, Brenda. That was so informative, and I think you've covered, almost everything. So I think there's so many questions from our audience who really enjoyed that, and so many comments saying how incredible it was and fascinating. So we have.
Thank you very much. Thank you.
Thank you. We have over 200 participants tonight, and I know lots of people watch as a family or as a couple, which is great. So one of the first things I wanted to ask you was something that comes up time and time again is about what you did mention in the presentation. But again, if you could explain, is there a limit in terms of the amount of fresh fruit we should be eating when it comes to type 2 diabetes, and particularly things that certain fruits which are considered higher in sugar, such as mangoes and things like that? What would your recommendation be for people with type 2 diabetes?
You know, it's really interesting. The research doesn't suggest adverse effects to fruit consumption unless we're over consuming calories, of course. And so I think for most people, I would say there are individual variations on how, you know, what you would tolerate. And a lot of people say in the context of a whole food plant-based diet, we don't see adverse effects to fruit. So I wouldn't say that people need to be that careful about fruit, especially in the context of a calorie restricted diet. I mean, I myself am a big fruit eater, and I know that the people running Mastering Diabetes, if you're familiar with Mastering Diabetes, they've had tremendous success with very high fruit diets in getting people into remission using mainly fruit. So I think that adds a little bit of weight to that argument as well.
Thank you. And as you showed, you know, in the presentation, we really want to focus on the whole fruits with the peel, with the
absolutely, absolutely, positively. Yes. And I think with juicing, the reason we have to be careful with juicing is when you consume liquid calories, it's not as satiating, and you get, you know, you eat 3 oranges to get 1 cup of orange juice. So you drink that so fast, it's so rapidly absorbed into your system. Even if you're juicing, getting as much fiber as you can in that juice and fresh squeezing it, it's still preferable to be slowly chewing those oranges, getting the more gradual absorption of those sugars. So generally, if you juice at all, the kind of juice you would want to do is a non-sweet vegetable juice, your greens and antioxidant-rich vegetables. You might have that right before your intact grains at breakfast to give yourself an extra boost of those antioxidants, but you don't want a sweet juice to be consumed.
That's incredibly helpful. So you mentioned this at the end that, you know, we clearly need the system change. And one of the questions is about, why do you think organizations, including the NHS in the UK, are not embracing the results that we're seeing in type 2 diabetes with plant-based diets? The most recent approach has been low-calorie shakes.
Yeah, I think there are a couple of reasons. I think we still need more data. And I think that will be really helpful, and that's coming. There's no question it's coming. And I think the other reason is people are hesitant to recommend a diet that sometimes they're not doing themselves. And they're hesitant to recommend a diet that they think their patients might not want to do. So often when I talk to groups, I often get the question or the response, I believe you, I know it'll work, but my patients would never do that. And my answer is really simple. How do you know? I mean, your job isn't to decide what your patients will or will not do. Your job is to lay their options out on the table. And I find I'm often surprised at the patients that would say, I would rather try this approach than be on, medications for the rest of my life and, die 20 years before I should. So there are lots and lots of reasons why, at the very least, it should be laid out as a viable option. But I do think that we who are using whole food plant-based diets need to recognize that the idea of just sort of unlimited food consumption within a whole food plant-based diet, well, hugely beneficial in terms of risk reduction of all sorts of diseases, may not be enough to achieve remission, because in order to achieve remission, the caloric consumption needs to be such that it will produce a loss of weight, and it doesn't in everybody. And I found this in my own work. There are plenty of people that figure out how to get an overabundance of calories even on a whole food plant-based diet. So we need to be sure that we are factoring in that caloric deficit, which may mean limiting to some extent those very high calorie or very high carbohydrate foods, especially in the early days, until we get the fat in the liver and the pancreas down so that we can get reversal of insulin resistance.
That was so beautifully said, Brenda, and I love that you said, let's not just assume where people are at and how they will respond to this information. It's our job to provide it. So there was a specific question that a lot of people had upvoted, so they wanted to hear about this, is why do you think blood triglycerides go up on a plant-based diet, but they go down with low carbohydrate diets?
They don't go up on a plant-based diet if it's done properly. We didn't see increased triglycerides at all in our participants. We actually saw huge drops in triglycerides in the Marshall Islands. The only reason you see increases in triglycerides on plant-based diets is because they're not whole food plant-based diets. If we see increases in triglycerides, people are using a lot of processed carbohydrates, and not even necessarily just processed refined carbohydrates, which are the worst in terms of increasing triglycerides. But we see increases in with processed, like breads and crackers and all of these kinds of foods that are processed and very rapidly absorbed. So and especially if people are over consuming calories, because excess carbohydrates get turned into triglycerides. So that's the issue. And we see lowering of triglycerides on ketogenic diets, generally because they're low in calories. They're calorie restricted instantly. And so they get a reduction in triglycerides. Carbohydrates are so low. And carbohydrates increase triglycerides, unfortunately.
Yeah, thank you for explaining that. So one of the questions that's come up again and again, and you must get this quite a lot as well, is obviously there's been a rise in the amount of processed meat alternatives that are available. So things like the Beyond Burger or other types of meat alternatives. What are your views on those around plant-based, in the context of plant-based diets and type 2 diabetes in terms of prevention, management, remission?
Well, there's no question to me. I celebrate every time there's a product that comes out that, I have to tell you, my son-in-law, we were at my daughter and son-in-law's place the other night, and they actually made these Beyond Burgers. And he's an omnivore. And he said, these burgers are so good. To me, they actually taste better than meat burgers. And he said, so why would I ever have meat burgers again? And that is worth a lot to me, to see that it could reduce the consumption of meat. And the differences, people say, oh, nutritionally, they're about the same as meat. Not true. They're not the same as meat. They contain some fiber. They don't have any new 5-GC. They don't contribute to the production of TMAO. They don't have as many endotoxins. There are a lot of benefits to these products as opposed to meat. But even that having been said, of course, these are not ideal foods for reversing diabetes or putting people into remission, because they don't have the fiber and phytochemicals and all of the wonderful nutrients provided by whole plant foods. So I would say generally, these foods are a great addition to the food supply for so many reasons, for ecological reasons, for animal rights reasons, and for health reasons too. I think they're better than meat. However, the best burgers and the best meat replacements are made with whole plant foods. So a black bean and quinoa burger would be the ideal replacement. You still have to read the label and look at you know, the types of fats and the amount of salt added and so forth. Making them at home is a great idea. We have a wonderful beet and lentil burger in, you know, in my books. Those kinds of foods would be really the ideal options, but having those convenient products on the market, I think, is really a wonderful thing. And yeah, not ideal for diabetes reversal though necessarily.
Well, I have the Kick Diabetes cookbook, and I really recommend it to everyone who's listening, because it's so delicious and really simple. I think a lot of plant-based cookbooks sometimes have about a lot of ingredients, but I found that, you know, just some of them have a lot less than 10 ingredients. Obviously there's herbs and spices, so it's really easy, just store covered.
Oh, thank you.
Easily available, which is really important, I think, to have accessible ingredients. So I'm just going to launch a quick poll before I ask the final question, so that everyone can vote. I know that we've gone a bit over time, so I want to thank everyone for staying on, and really appreciate it, because you're just such a fount of knowledge, Brenda. You gave us so much this evening, and the comments that have been flowing in have been amazing. I'll send them to you afterwards. But I want to wrap up with a final question, which is around, in your experience, what are the biggest challenges for patients to remain in the whole foods plant-based lifestyle that you have so beautifully outlined in the last hour?
Well, I think the biggest challenge, in my view, is you know, one of the things as human beings that I think is more important than almost anything is the feeling that we belong within our tribe, that we belong within our family, within our, our group. And right now, at this point in time, being plant-based is still not the norm culturally. And so it means for many people being different than their tribe. And that's hard, and it's something that I think is a big barrier, but it's something that I'm very, very grateful that is changing, and it's changing rapidly. So that's really, really wonderful. We're seeing much more mainstreaming of plant-based diets. We see plant-based options in restaurants. We see more choices in the grocery stores, and we see our families, at least in my case, we see our families opening up to delicious plant-based foods. And I think that's one of the best things we can do, is, not just setting an example of great health and joy and all of those things, which is really important, but sharing delicious food. That is probably the biggest barrier for a lot of people, is they're scared they won't like the food. And, other than our, want to belong, we want to eat really good food. And so just having the opportunity to taste and share and enjoy beautifully crafted plant-based meals can make a huge, huge difference for people.
That was so well put, and I completely agree. And as you showed in the session, no matter what your culture is, there are ways to enjoy plant-based foods that are in line with that wherever you are. And we're trying to change this and make it more acceptable and easier. And thank you for sharing this life-saving information with everyone. I know we have tons of health professionals who tuned in today, lots of GPs and so on. So thank you again for giving up your time and sharing your expertise. And for everyone who's listening, Brenda has actually been on our webinar platform last year with the co-author of the new book, Nourish, which recently won an award in Canada as well. And it's incredible.
And Rohini, we just won another award in the United States as well. We're very, very excited about that. So 2 awards now.
Oh my gosh, and counting. I'm sure there'll be even more. So that is an incredible book for the whole family. So anyone who's, worried about how to introduce this, and they have young children or family anyway, this is a brilliant book, and covering everything, including even plant-based pregnancy and so on. So highly recommend that. And if you're a member of Plant-Based Health Professionals UK, that recording is in our members area. But thank you everyone for joining us. We had great attendance tonight, and I really appreciate your sticking with us for the session as well. And we'll see you in a couple of weeks to discuss plant-based pregnancy. And thank you so much, Brenda, and we'll speak soon.
Thank you, Rohini, and thank you to everyone who took so much valuable time to be with us this evening. Thank you.